Seattle was the original epicenter of COVID-19. We were the ones to first experience this pandemic. Particularly for the Native community, we did not get the resources that we needed when COVID first began. The Seattle Indian Health Board was one of the very first in Washington State to get the Moderna vaccine. That didn't happen by accident. We have been fighting to ensure that we are getting what we need in order to fight COVID within our community.
I actually had a panel interview with our Native families. Our youth were the ones who said, we need you to take the vaccine first. We want to know that you're not asking us to do something that you wouldn't do yourself. So I was the first person in the state of Washington to receive the Moderna vaccine. I think the more people who can demonstrate that the vaccine is actually safe and effective, the better off we'll be.
The vaccine has been tested with thousands of people across the United States, very strict clinical trials, and Native people were included in them. These vaccines are safe. They do have side effects. You need to make sure you know what those side effects are. If you are in one of the groups that could be adversely affected, your providers here at the Seattle Indian Health Board will let you know whether or not you should be vaccinated.
When you call the Seattle Indian Health Board, you can choose two different options. One is if you're experiencing symptoms and you need to receive a COVID test. And two is if you want to receive a COVID vaccine, you can press a button to actually get somebody on the phone to get signed up to get a vaccination. At this time, it's really important for folks to get enrolled as patients at the Seattle Indian Health Board because that's how we can be able to provide the vaccine. If you're an elder, especially if you have any illnesses like diabetes, heart disease, or asthma, please come in and get your vaccination. The next phase rollout will be Native 18 years old and up. If we can get enough of the vaccine following that, then we'll open it up to everybody.
We're not more likely to get COVID or to die from COVID because we're Native. Being Native is what makes us strong. Right now, it is so important for us to take every necessary precaution to ensure a great future for our next generations.
The Seattle Indian Health Board exists to serve all of our relatives. From an Indigenous perspective, we're all related. So I'd like to invite you to come to the Seattle Indian Health Board and become part of our family.